Okay, this question comes from one of my CPT coding videos that I posted last week. It says, can you post the chart that you were using? Okay, it was from here. This is called the Future Medical Coders Logbook, and I'll show you how this works. Okay, these are just some examples that I did videos for last week. Okay, but you have one column for diagnosis or procedure, main terms, subterms, your page number, your final code after verifying in the tabular, and then a spot for guidelines or notes. Okay, so I designed this for my students because a lot of times when you're learning coding, it's very easy to kind of get lost with the first couple of steps with coding. So this is a kind of way to write out your thinking process so you can go back to it later and learn from it. Okay, so for this first example here, I was looking for the diagnosis diabetes with neuralgia. The main term in the index is diabetes. The subterms were with and then neuralgia. That was on page 134 of the book. Okay, and then after going to the tabular, that code is E11.42. And then for the guidelines or notes, okay, depending on what you're coding, you might not have anything written here. Okay, but for this one, I just put the guideline. If the type is not documented, it defaults to type 2, diabetes. Okay, this could be used for CPT coding as well. For this example, I was looking for the code for a hand x-ray. The main term is x-ray in the index. The subterm is hand, and that was on page 1341 of the CPT book. Okay, after verifying in the tabular, this example, I was looking for the code for 2 views, which would have been 73120. And for my notes here, I just put that the code is based on the number of views. Okay, so this is how the whole book is set up. It's 100 pages and you can fit 5 codes per page. So you can fit 500 codes in this logbook.